Welcome back, 811. New research was recently released about breast cancer. It said women with early-stage breast cancer do not benefit from chemotherapy. So what does this all mean? Well, joining us now with more is Doug Duncan, Director of Pharmacy at Adventist Health Castle. Good morning. Thanks for being here.
Good morning, Christine. Thank you for having me.
First of all, chemotherapy. Explain what exactly that is.
Chemotherapy is more or less anti-cancer drugs that are used to slow or stop the growth of fastly dividing cells like cancer cells.
Okay, and then what are some of the risks and side effects?
Well, chemotherapy can be rather devastating in terms of side effects. Probably the most common side effects that people associate with chemotherapy are severe nausea and vomiting, but also we get suppression of red blood cells and white blood cells that can lead to severe fatigue and possibly secondary infections. So it probably is the biggest terror for patients when they know they're going to be receiving treatment for cancer.
I mean, no one wants to go through this, and you don't want to see your loved one go through this. So this, I guess, new study making these groundbreaking claims saying that some women with breast cancer don't need to go through chemotherapy.
I'm so happy. Cancer research is alive and well, not only in the U.S. but all over the world. Recently, the TAILOR-RX trials was a study where patients that had certain types of breast cancer in the early stages, like HR positive, HER negative, node negative breast cancers, they took a sample between 6 different countries of approximately 60,000 patients. Of those, 7,000 qualified for the study. And what it is that through biopsy and gene examination, they can determine a patient's, through the biopsy, whether they're low, intermediate, or high risk for return of the cancer. And so traditionally, low-risk patients have received hormone blocking therapy, which blocks estrogen and progesterone in the breast tissue to prevent the growth of cancer. High risk was a combination of surgery, chemotherapy, and very often radiation. The intermediate group, which is the group that this study addresses, was kind of a gray zone. You know, do we do too much or too little? So they took, of this intermediate group, they had 7,000 participants. They divided it in two. Half the group got low-risk therapy, and half the group got high-risk therapy, hormonal chemotherapy, radiation. And after 10 years accumulation of information, the longevity of the two groups was the same. So from that, they concluded that if you had intermediate risk for this kind of cancer, then it wasn't necessary to go through the chemotherapy, which is great news for a lot of patients.
So for patients who are undergoing chemotherapy now or who are about to start, what do you want to tell them? Do they need to rethink their plan?
Only for this select group. The trial was groundbreaking and it was phenomenal news, but not everybody with cancer is going to benefit from the study. So out of 60,000 participants, 7,000 will benefited from that study. But going forward, I think we're going to find in many cases research is going to show where we need to apply chemo and possibly where we can back off on that. But it's still one of the most principal treatments that we have for cancer, especially breast cancer.
All right, thank you, Doug Duncan, for being here from Adventist Health Castle, which is doing a tremendous job. In fact, recently got honored with an award.
Yes, we were the 2017 recipients for the Malcolm Baldrige Award for Excellence. This is a presidential award. It was a culmination of 15 years of effort. Kathy Rakeful, Laura Westfall, Travis Clegg, and Steve Bovey and Eric Anderson. They were the leaders that inspired us to achieve this goal. And it's just the beginning. In order to be Baldrige recipients, we have to take our level and keep it going and go to the next level. Castle also received a designation of being in the top 10% of hospitals in Hawaii and nationally.
Wow.
So that's out of over 3,000 hospitals, we're in the top 300.
Well, congratulations.
So we're very proud of ourselves.